Well, welcome to this meeting, Community Response Task Force. I'm so proud to introduce the Fields, Jess and Jess Jr., who were also gracious enough to host us. And thank you so very much for that. So this is a restart of CRTF after the COVID restrictions. We're trying to work with them as best as possible, and this is our first time offering a virtual option as well, which that's going to be posted on our Facebook and website. It's a resource for the partnership. And I've asked Jess if he wouldn't mind being our first speaker for the new season, so to speak, and to address basically his business, what has this done to his world, and where does he see it going? And so welcome.
Thank you.
Thank you. All right.
Thank you. Well, we'd like to welcome everybody in virtual to Rosewood Community Room, and we're proud to host you guys today. I've always been told there's the difference between a good speaker and a great speaker is gifts. So I have a little gift for you guys. And Jess, if you can pass those out.
You feel good, very good.
I still have your umbrella.
Yes, the umbrellas, you guys got an umbrella last time. This time you're getting a pen, and it's an incredible pen. Anybody watching, come see me. I've got a pen for you too. So please come by and see us, and we will we'll provide you a pen. There is a little bit, you have to take, there's adhesive strip off the ballpoint, and it's the best writing pen that you will ever have. So we're proud to provide that. I have a couple of thoughts for the day before we get started. And if you've ever wondered this, and I have, I like to have some thinking points. So these are thoughts for the day. Why don't sheep shrink when it rains? Why is lemon juice made with artificial flavor and dishwashing liquid is made with real lemons? Yeah, these are thinkers now. Why is it that doctors call what they do a practice? Makes you wonder, huh? Why do they sterilize the meat for lethal injections? Right. And why didn't Noah swat those 2 darn mosquitoes? I had a joke, but I figured I would probably bypass the joke, Philippe, because it might not come off well on the internet, so I don't want my name being thrown around. But we're very proud to host y'all. We're very proud to tell you a little bit about what Rosewood Funeral Home does and how we're handling this pandemic. And what a crazy world that we're in today. I mean, it's absolutely crazy. And most of you are in emergency management or police or fire, or you have some activity with that. And let me say my hat's off to all of you, because I know how difficult it is out there. And so I really admire each of you for participating and taking your time out to be involved in this organization. I would like to introduce my son, Jess Fields, Jr. And Jess Jr. is a 4th generation in our business. He is a graduate of Kingwood High School, and unfortunately, he is a graduate of Texas A&M. I say that because I'm a Baylor Bear. I tried to get him to go to Baylor, and he said, I'm going to A&M, and he did very well at A&M. But I'm going to introduce Jess Jr., and he's going to talk to you a little bit about the pandemic and about what we have done to try to help and to provide during these difficult times.
Thanks, Jen. So thank you all for being here, and I appreciate you guys working so hard, those of you who are joining us online, and those of you who are here in the room, on trying to make sure that our community is ready for these difficult situations. Obviously, in Houston, we are in a really interesting pickle, because not only are we one of the fastest growing pandemic centers at this moment, but also we are at the cusp of what most meteorologists project will be one of the most active hurricane seasons in recent memory. We live in Southeast Texas, so emergency is what we do. Rosewood takes a number of unique precautions to ensuring that we are ready for these situations. And I'm going to go through several different aspects of that in some detail, not too much. You don't need a funeral license here today, so I'm not going to give you a full scope. But I'm going to give you some specifics so that you understand mainly that we're prepared, and that some of the funeral homes, certainly not all, but many funeral facilities are prepared, try to be prepared for these situations. And also actually understanding what the risk is in what we call the funeralization process. What is the risk of someone that is sick with the pandemic? What's the risk for their families? But I should probably start by defining our categories, because there's really a few different risk factors. You know, someone that I respect a great deal, and I've had the blessing of having lunch with on numerous occasions, and he's also a very dear friend of my father's and of our family in general, is former Harris County Judge Ed Emmett. And I talked to former Judge Emmett not too long ago, and one of the things that he told me was that in planning for risk management and emergency management, you have to identify up front what your risk areas are. So in our business, there are several risk areas that stand out. The most obvious that most people would think about is obviously the body itself, right? When you have a person that has the novel coronavirus, SARS-CoV-2, COVID-19, whatever you want to call it, that body is, in theory, most people would think a vector for disease, although I'll get back to that point in a moment. The second aspect is those who are surrounded that person that maybe was infected, okay? That might be the family, it could be friends, it could be first responders, frankly, it could be people who were around that individual at the time that they were infected, actively alive with the coronavirus, and some would think maybe after the body has died. Then we have what is the most visible thing, which we have probably, many of you have read stories about this, which is the funeral service itself in this pandemic. Because even as the pandemic goes on, our society has a very strong feeling about ensuring that people have a respectful burial. You know, you saw pictures during the very beginning of this that in Iran they had mass graves. Well, we don't do that in America, right? We make sure everyone has a respectful burial. It's very important to us as a social construct and as an institution. So these are the three risk factors I want to go through, the areas that we need to identify and think about. And I'm going to go into a little bit of detail. So first, let's talk about the body. At the very beginning of this, I spoke with a funeral director in Seattle, Washington. This is the heart of the original pandemic, if you think about it, in this country. My dad, who has served on the State Funeral Commission, also was in touch with numerous funeral directors and funeral home owners throughout the country. And our emergency management coordinator in the funeral business, we have one, is our operations manager, who actually handles picking up and removing people into our care, as we say, when we go and get a body. And what we quickly discovered was that we didn't really know originally whether or not coronavirus would be infectious after a person had actually died. And that was, of course, a concern. But our suspicion was that it probably wasn't very infectious. And the reason for that is, if you think about what is required for a virus or a bacteria to continue to live, it must have a host. It must have a living being. Most viruses, and certainly bacteria much more quickly, actually die out fairly quickly after a person dies. So for example, Ebola, our chief operations person, our emergency manager within our business, was actually one of the people who responded to the Ebola crisis. So there's a disaster response team in mortuary service, and there's a state team for this. He was one of the people that responded. You would think Ebola, my goodness, who wants to handle a person who's died of Ebola? That would seem like the most dangerous thing in the world. But actually, no. After a few hours, any trace of infectiousness is gone. In fact, right now, the CDC says that for anyone who is testing for coronavirus through what is called a nasopharyngeal swab, actually doesn't even need to wear one of these, an N95 mask. Now, we provide these to our employees. We provide this certainly to the people that are going out on what we would call first calls, when we go out and actually remove someone into our care. We make sure they have gloves, okay? And we make sure that they're prepared for anything. But right now, according to the CDC, that's not necessary. Because as time has gone on, they've discovered that even though coronavirus has some unique aspects, it's extraordinarily infectious when this person is alive. When they are actually deceased, it seems to act like other diseases. That's the first thing I would tell you as a point of kind of calm, I hope, because even some funeral directors, even some people in our business think that this is a concern still, but the CDC's make clear that it's not. Now, the second thing is a greater concern, and that is the family members and the friends that surround someone that has passed on. This is a very difficult thing, and obviously we know that hospitals are limiting the access, and nursing homes and so forth, limiting access to family members who have suffered from the novel coronavirus. It's heartbreaking. It really, really is. You see the pictures of people that are going at them, you know, they're touching the window. They can't even be there with their loved one. That is very heartbreaking, but it is also, in some respects, an act of mercy by those families that have to go through that, because the rest of society undoubtedly is put at a bigger risk the more people that are living that are exposed to those known cases. And this is why people are doing contact tracing, and there's other attempts that are going on now to try and identify who's in touch with these individuals. But when we have a funeral service, the first thing we do is we meet with the family. Sometimes they want to do that in person, and sometimes they're willing to do that now over video. We offer technology to do it over video conferencing for the first time ever. But the risk is there. And the real risk is a risk that maybe you all can work with as you guys go forward thinking about emergency management, because this is a problem I haven't figured out a solution to. My dad hasn't, and none of us have. When a person has coronavirus, there is right now a sort of stigma around that individual. Is that fair to say? The family members are afraid of the stigma as well. They don't want to be associated with something that might cause them to be treated differently than other people. They're afraid that they're going to be cast off, that they're not going to be spoken to. In fact, it might be a case that somebody's family member's sick, they don't even live here. But if you say, well, you know, my so-and-so had coronavirus, then guess what? Suddenly people are going to look at you and they're going to back off. They're concerned. So I think people are less likely to disclose that their loved ones have coronavirus. And this is really a concern. I recently met with a county official about this very concern. The fact that we don't have a clear knowledge at this point in time whether or not many family members and even first responders are really adequately trained to give us that information. You know, so when we hear from a family, we expect to say, hey, if they've had coronavirus, if they've had an infectious disease, we ask this question. And unfortunately, we don't always get an answer to that that's totally forthright. And you can understand why. And so that is a concern, and I think there's recently been, just here in Houston, several stories recently in the local news about how maybe the potential deaths are actually higher than what has been reported in the official tallies. And the reason for that is that people perhaps are dying at home, and it's not being reported that they maybe had an infectious disease, or that maybe they died of a heart attack or something like that. The third risk factor, so we've spoken about the body, we've spoken about the family and the friends and those in contact. The third risk factor is the funeral itself. Now, at the end of the day, while we can try to impose guidelines and make sure that people don't come to an overcrowded facility, whatever, you know, if you have people that want to gather, you're going to figure out a way to gather. So it's one of those things that, I mean, Dad could tell you endless stories where we can try to corral people and make sure that they don't gather. And we've enforced clear boundaries. And I would encourage you guys who are here to go and see our chapel where we've actually taped off rows in our funeral chapel. But still, we can't limit people from gathering outside of the funeral service. We can't encourage people to do too much. We can only take care of our situation. So there is a clear need, I think, for individuals to be educated about the fact that there are other options. And the way we've addressed that situation, the solution we provide is we have now some absolute top-notch streaming technology to do video conferencing with arrangements, as I mentioned, but also with the funeral service itself. This has really not been done before in the quality that we do it, especially here at Atascocita, by any funeral home in the Houston area. And there may not be a one in Texas that does it as well as we do. I'm bragging a little bit, but you'll forgive me because we really do a good job. And we've invested the money to do it. But because we care so much about giving the families that benefit of being able to have a dignified service and not have a disruption in the funeral process, we don't charge anything extra for that. So when a family needs that service, they're going to be able to get it. And we think that's the best practice, and we would hope that all funeral providers would do that, although frankly not everyone has the ability to make those kinds of investments. But here at Rosewood, that's what we do to try and help families. And I would say too that finally, you know, when we talk about risk management with the coronavirus, ultimately it's a matter of personal responsibility. Whether you're communicating with a funeral director, whether you're talking to a first responder, if you've had a death in your family or somebody that you know, if you have someone that's not been feeling well, if you're in a situation where you might be gathering a group of people together for a funeral service. And these are things that there needs to be a clear communication. When people aren't talking to one another, that's when we get into trouble. Okay. We get into trouble when we don't know whether a person's been feeling unwell. We get into trouble when we don't know how many folks are going to show up. We get into trouble when we don't know the needs of the family we're trying to serve. I think that's true across the funeral business. But those are a few of the things that we've identified as important areas to address and a couple of the solutions that we've come up with. It's not comprehensive and it's not perfect, but we're doing the best we can. And I do believe, and I'm a little biased, but I believe that Rosewood's doing as good as anybody in the state and perhaps as well as anybody in the nation. We followed the very best practices from day one. I have to give a lot of credit to my dad because right at the very beginning, he went out and bought a bunch of these N95 masks. These will prevent people from getting the coronavirus. Unfortunately, most of the masks that we wear, we see born, don't prevent people from getting it. But our staff members need to be protected because of the risk factors. So anyway, that's what I've got to share with you today. I appreciate you guys being here. And if you guys have some time for questions, we're happy to take them.
What you talking about the mask giveaway, Jess?
Oh, yes, well, thank you, yeah. So one of the things that Dad said at one point was that he felt it was really important that we didn't just keep these to ourselves. You know, we went out and we got several thousand of these, and obviously there was a point, and you remember this, when we didn't have masks available anywhere. I mean, now, the other day I was in Walmart, and you can buy Hanes masks. I can't even believe that. But, you know, there was a point when actually we were one of the only groups that had masks. The county didn't have masks, the city, the public health departments, the hospitals. So we thought it would be nice to offer this community, Atascocita, where we have such deep roots in the Humboldt area, the Lake Houston area, the opportunity to come and get masks. So we put some bags together, and we actually gave every family that lined up out here 2 masks. And I think we gave close to 1,000 away or something.
And it was amazing. Cars started lining up 3 hours in advance.
Yeah.
Lake Houston Parkway, people wondered what is going on because we really did not advertise it. One of the news stations heard what we were doing. We didn't even call them. They found out. They put it on their They put it on their station, and we had cars lining up 3 hours in advance.
Right.
And people were crying when they received the
really
masks. So it was something that made me and made Jess Jr. feel very proud that we're offering something.
Yeah, and that probably the last thing I should say too, and since Dad brought that up, is, you know, funeral businesses are in a unique place in our world because we deal with people at a time of difficulty and grief. It's easy for some funeral businesses to think they're going to take advantage of that situation, but most funeral businesses, thank God, are responsible pieces of the community. I mean, we know families over many generations. So when we have a situation to help out the community like this, an opportunity, we try to take it. And we try to take it, and I've been really thankful and grateful. I've seen so many local businesses, they can't maybe give away masks, but they're doing the little things that they can do. And I think that's pretty universal, because this is a wonderful community we're in. And, you know, every business, whether it's a hotel business or any kind of business, everyone is giving back. So thank God for that. But I'm glad you mentioned that, Dad. So if you guys have some questions, we'd be happy to take a couple.
I have one.
Yes.
How hard, I mean, thinking rules, regulations coming up because of the COVID, it's new. Do you think it's gonna change anything fundamentally?
From the funeral
The
business.
general business, and I mean, this could have been a pandemic, it could have been really, really bad. It did happen, it's gonna happen again in some other fashion in the future. How are new laws going to affect your business?
I think that it will certainly be remembered for a long time. I don't know if anything is going to change. I think once we're going to have a solution before we get back to somewhat of a normal. And I don't see that happening anytime in the near future. I think it potentially could be this time next year that we have a vaccine, hopefully, that will make everybody comfortable. But I think it's going to last for some time. What we're seeing from the county and the state level, laws are changing just about on a daily basis. We've gone from 10 people limited to 50 people, back to 10 people. Now it's at 50%. Then here it's going to go back again. So we're pretty flexible. We're just kind of going with the tide, and we're trying to provide the family the best experience that we possibly can. But some of the sad situations are, during the beginning of this, we have had some members of our community that did pass away. Solomon, you know one gentleman I'm talking about that is a dear friend of all of ours, and I'm not going to say any names, but in a normal situation, there would probably been maybe 1,000 people or more at his service. There were 6 people at this gentleman's service because it was limited to 10 people, and there were 6 family members, and so the wife couldn't say you can come and you can't come, so we limited, so that she limited to the number of family members they had. There will always be the opportunity to come back, and we've offered at a later date when things do become normal to come back and have a memorial service for these individuals. But that's how tough it's been, especially in the very beginning. It's very, very sad in so many ways. Probably if I asked the question 4 weeks ago, did y'all know anybody that had the virus personally 4 weeks ago? I'll just ask that question to myself. I knew no one 4 weeks ago. I mean, we dealt with families, we had some of it, you know, within our business, but I didn't know anybody. Today, 4 weeks later, I can say I probably know 20 people that are now have the virus. 20 people. I mean, that's amazing. And there are a few people that are fighting for their life. This is a very, very serious situation. So what I can say is what everybody else tells you: wear your mask, be very precautious about where you're at and who you're with, and wash your hands, because it is going to continue to be a problem for our community. So please be careful. Everything to add?
No.
And, you know, my question also would be, when all of this started, was there any kind of coordination between the funeral homes or funerals, professional organizations like this one is coming, get ready? And is there a plan for something like that? So if the next wave, you know, were to come back and it'd be 100 worse.
Is everything
So-
in place?
You want to answer?
Initially, there was little guidance from, there's several trade organizations. The most notable is called the National Funeral Directors Association. And their initial guidance was wait and see and listen to the CDC. That's the reason why my father and myself had to reach out to different funeral homes ourselves to do some research and find out what was going on in these hotspots, Seattle, New York, etc. The initial confusion, actually for us, related to the disbursement of PPE, the personal protective equipment, because, you know, when there was this big, if you remember back in March, so I think the president's speech was a week and a half into March or something like that, like March 9th, March 10th. There was an announcement that the strategic reserve would be tapped for the personal protective equipment. You remember that? And that meant that all of this stuff, the U.S. stockpiles for emergencies, was going to be released to local communities, first responders, hospitals, people in need. Well, I did a little bit of outreach. We looked into that as a business to see, well, could we benefit from some of that, you know? And we were already making plans to get some masks ourselves at that point, and already had some because we were very well prepared. But we were just saying, you know, is there funeral homes on this list? And as it turned out, the answer was no. Funeral homes weren't even considered in the disaster plan. Now, as I mentioned earlier, there is a statewide disaster mortuary response team that actually will go out to big disasters. We have our own huge amount of preparedness. I mean, we have facilities that deal with very large disasters and a very large number of people who might be deceased at any given time, more than pretty much anybody else in our area, really. However, when it comes to where the authorities were, unfortunately, we weren't really on the list. You know, and I think that's a short-sightedness. So we've gotten additional guidance from these trade associations, although really for a little while we were just following the guidelines. I think that what needs to happen going forward, I believe, is that when we see the federal and state governments continue to respond, and if there's a second wave of this and whatever, you know, you cannot forget about the fact that funeral homes are not at quite the same level as maybe first responders, officers, and firefighters, but we're close. I mean, we're there. We're responding pretty fast. You know, we're right there when a person has died. We have to deal with that situation. So I think that hopefully in the future there will be some additional thought given to that. There hasn't been as much, but I don't know that that's anyone's fault. I just think it's something that will get better hopefully in the future.
In New York, many of y'all remember New York, there was a huge problem. They had no places to put the remains. And you probably saw pictures. I mean, they had them outside their back door. There was no refrigeration. They had no place to put these corpses, which was so sad. I mean, you would open the paper and you would see this and you go, this cannot be right. Well, we made several calls because we wanted to try to be prepared to find out what was going on. And of course, back when all this began in New York, they had no medication to treat. They didn't know what was going on. I mean, they were not prepared for what was coming over. Nobody thought it was going to actually come over, but when it did, they couldn't stop it. They just didn't know how to stop it. We're very fortunate, as Jess Jr. said, and I think I mentioned this in the last meeting that I talked. We probably have the largest refrigeration unit in Texas. We can house about 400 plus if needed. So we're not in the same situation as most of the small funeral homes up in New York. And they have maybe a cooler of 2 or 3, and here all of a sudden they're getting 100 a day, 100 a day. And they're getting in New York, I think it got up to 1,500 or 2,000 a day. So they were spreading it out to all these funeral homes, but they had no ability to to house. And we're very fortunate, and we do. So we're not wanting that to happen. We don't think that will happen. We're very positive about what is going to occur from here on, but we are prepared. Yes, ma'am.
Do you anticipate that the demand for the virtual services will continue after COVID-19 ends?
I do, yes, ma'am. I believe that we will continue to see that for a variety of industries and businesses. I think in our business, people want the flexibility to be able to have a funeral service that suits their life. So with, if we have, just in the past year and a half, I'm thinking of numerous situations where we've had people that have had family in India or Africa or Europe. And in the traditional model, those people would have to book a plane ticket at the last minute and fly all the way over here. And of course, that's nice to be there for a service for your family members, but it's not always practical. And right now, it's impossible. So we're giving people the flexibility to have a service that brings everybody together, brings the whole world together. Just as you guys are able to have people here that can't physically be here for whatever reason. And so in the funeral service, I think you're going to see that just continue, that trend continue.
And it's good. We have done many services here, streaming. We've done many services in Humble, and we've done services everywhere. So it's something that I think is very, very good. It's a very positive trend. If anything comes out that's positive, that's a positive trend.
Thank you.
Well, there are no more questions. Thank you very much. You? See, I'm getting this is virtual. But thank you so very much. Not only for hosting us, but this was really different for me. And it almost sounds like the community response effort is how you approach it. So I touch this. You're being local.
Thank you for asking us.
Thank you so very much. And as a token of our appreciation, I have a little something, and it is a little something, but not to our budget, it means a lot. But when we give you this, it's a gift certificate to a local restaurant, Lost Cajun, and why? Because they too have done so much during the hard situation, and we do want to recognize them as a community. You discover that you discover.
Thank you. Thank you. Thank you. Thank you. If anybody would like a tour of our facility and how we are setting our rows apart, Jess Jr. would be glad to give you a tour. He's great to attend to.
Yes, I'd love to show you guys how we're doing that in our virtual meeting room and some of that if you want to see it. Yes,
You missed out on the press.
The